Study is looking at the use of common drugs used to treat ADHD, and it also found more people are being prescribed those drugs.
Yeah, and there's also an increase in the number of middle-aged and older women taking them. Here's a look at some of the trends of the treatments.
ADHD and treatment for ADHD is no longer a child psychiatric disorder, and it doesn't just focus only in boys or young men.
ADHD is one of the most common neurodevelopmental disorders, and there's new information showing its impact on women who are middle-aged and older.
These results may be explainable in terms of showing there's progress being made in terms of addressing these gaps in mental health care for women.
Panagiotis Thanos is a professor at the Jacobs School of Medicine and a senior research scientist in the Clinical and Research Institute on Addiction. He says while some common ADHD symptoms include inability to concentrate, to focus, inattentiveness, hyperactivity, and impulsivity, they aren't the same for everyone.
If someone is aware that they're having these significant impact on their quality of life, and that there are opportunities available to help with those, I think that's where the conversation begins.
The study by researchers at the National Institute on Drug Abuse also found that women ages 35 to 64 are the least likely to report misusing drugs used to treat ADHD, like Adderall and Ritalin. And Dr. Thanos says this age group needs to be studied more.
Even if we have data already, we cannot just kind of assume that the data will be the same for men and women.